Good morning. Today we are going to discuss one of the important topic from pharmacology, that is general anesthesia, general anesthetics. Here you will get idea regarding anesthesia, different types of general anesthetics and application of that. So first of all, I will try to share my screen. So here general anesthetics is there. So here you something you have to know. Means this is the contents. These things you have to know. Means introduction, stages of general anesthesia, classification of general anesthetics, pharmacology of the drugs, and pre-anesthetics. So here it is important. The stage again classification you have to remember. And next, you have to know this is the introduction. Means you have to know the definition of general anesthetics. And general anesthetics, why it is used? General anesthetics is used to cause reversible loss of sensation and consciousness. And main intention of general anesthesia, general anesthetics, is to lose sensation, all sensation including pain, especially pain, and to cause amnesia. Amnesia means sensation of sleep, and to cause muscle relaxation as well as somatic and automatic reflexes evolution. This thing. And here different stages of anesthesia. Different stages of anesthesia also important. You have to know. You have to remember the 4 stage of anesthesia. In MCQs, they may ask what is the second stage of general anesthesia, or fourth stage of general anesthetics or anesthesia, like that. And you have to know when this stage is will be there after using general anesthetics. Means first stage is stage of analgesia. In this stage, pain sensation will be lost. This stage starts from beginning of anesthetics, inhalation, and lasts up to loss of consciousness. Okay, and in this is the normal stage. Means you can say in this stage is pain progressively abolished. Means pain decreases gradually. Pain will decrease, and in this stage reflexes and respiration remain normal. But in second stage you have to remember the name. That means stage of deliria and excitement. But in second stage you have to remember one thing. This point you have to remember: no stimulus or operative procedure carried out during this stage. And in this stage some side effects or some complications may be there, like vomiting or defecation, micturition, some problem is there. And this stage is from loss of consciousness to the beginning of automatic breathing. Okay, and this point you have to remember. Okay, and next you have to know third stage is surgical anesthesia. That means in this stage surgical procedure is carried out. In this in this stage 4 phases is there. Means plan 1, plan 2, plan 3, plan 4, and you have to remember this plan. In exam they may ask what are the phases of third stage of general anesthetics. And fourth stage is medullary or respiratory paralysis. Name and along with simple introduction you have to know. And I have taken this from KD Tripathi, and you can read once. for your clarification. And next, this is also from Kadi Tripathi. You can see the stage, different stages of general anesthesia, first, second, third, and fourth. And you have to remember the uses. Means in first stage, analgesia is used in case of labor, but in second stage, no operation is carried out. In third stage, most of the operative procedure is carried out. And in fourth stage, there is no operation. Means a patient may die in this case. And so, next you have to know the types of general anesthetics. This slide is very, very important. You have to remember this. And you see, two types of general anesthetics is there. One is inhalation type, another is intravenous type. In inhalational type, again two types, gas and volatile liquids. You have to remember the gas. In nitrous oxide is one of the general anesthetics, and it involves in inhalational types. Means it gives through nasal. So these are the example of volatile liquids. And in intravenous, two types of drug. One is inducing agent, another is slower acting. You have to remember the example. Means the dissociative anesthetics, example is ketamine. Opioid, example is fentanyl. Fentanyl and benzodiazepines, example is diazepam, lorazepam, etc. And inducing agent, that is thiopental. This, if you remember this class of drugs, then around 3 to 4 MCQs in exam you may get. And if you know the classification of drugs, then you can write the correct answer. So after that, first drug is diethyl ether. And you have to remember here the simple properties of diethyl ether. That is, diethyl ether is colorless, highly volatile liquid, and again it produces irritating vapor and inflammable and explosive. Mostly you have to remember these points. Maximum drugs are non-irritating in nature, non-inflammable, but diethyl ether is inflammable. And in pharmacokinetics, you can see it is eliminated through skin, urine, as well as sweat glands. And this diethyl ether can cross placenta. And you have to know the advantage and disadvantage. And next, second one is nitrous oxide. And nitrous oxide, also known as laughing gas. You have to know this laughing gas. And you see, this one is non-inflammable and non-irritating in nature. And in advantage, you can see non-inflammable and non-irritant. But it is not potent alone. It may cause hypoxia. These are the disadvantages. And again, this nitrous oxide do not cause nausea and vomiting. Okay. And you see in disadvantage, it may inhibit vitamin B12 metabolism. So these are the some advantages and disadvantages of nitrous oxide. In case, again, you will get from halothane. Halothane is one of the important general anesthetics. And you can see here the pharmacokinetics of halothane. And again, advantage and disadvantage of halothane, you have to know. These are one also non-inflammable and non-irritating. And this halothane may maintain hypertension, controlled hypertension. So, but halothane is one of the potent and speedy induction and recovery, general anesthetics. And in disadvantage, you can see this halothane may cause respiratory depression, and it may prolong labor. So halothane also have advantage as well as disadvantage. Again, drugs like inflorin, anflorin, isoflorin is there, and this one is non-inflammable. And maximum general anesthetics are non-inflammable except diethyl ether. You have to remember that. Isoflorin, you can see here. It is the isomer of enflurane. You have to remember this point. Isoflurane is enflurane, isomer of enflurane. And next, you have to know isoflurane advantage, disadvantage also there. You have to remember. In advantage, you can say a rapid induction and recovery, good muscle relaxation, and it have no renal or hepatotoxicity, and it may cause nausea, vomiting, but not that much. Okay. And again, you have to know the intravenous anesthetics. If you know classification of that intravenous anesthetics, then you can write easily. And here, this is the classification of intravenous anesthetics. Next, one by one, you have to know. In intravenous anesthetics, you have to remember thiopentin sodium. It is one important drugs in case of intravenous anesthetics. And thiopentin sodium is one of the barbiturate, ultra short acting barbiturate. And this thiopentin have some adverse effect, like laryngospasm in case of pre-anesthetic course, and it may cause gangrene. Okay, these are the some side effects of thiopentin sodium. Again, some advantages and disadvantages there. In general anesthetics, you have to know about thiopentin sodium. Thiopentin is important drug. You can see in advantage, it causes a rapid induction, and thiopentin is used in case of short operation alone. And in disadvantage, you can see depth of anesthesia difficult to judge. And again, poor analgesic and muscle relaxing activity. It may cause gangrene and necrosis. It may cause shivering and delirium. So advantage also there, disadvantage also there. You have to know that. And again, propofol. See, propofol is, you can say, it is replacing thiopentin. Means nowadays propofol is used in place of thiopentin. Means thiopentin is replaced by propofol, and this thiopentin propofol is used based on some properties. You see, in advantage, it produces rapid induction, does not sensitize myocardium to the adrenaline. Again, it not cause any nausea, vomiting, and this propofol is non-explosive and non-irritant. And so some disadvantage also there. It induce apnea. It may cause hypotension, bradycardia, this all. So advantage is there along with disadvantage also there. Again, ketamine. Ketamine, it is one of the dissociative anesthesia, and this ketamine is given to cortex and subcortical areas, NMDA receptors. And you have to know the some disadvantage of ketamine, that ketamine may lead to hypertension, and this ketamine also cause uterine stimulation, and this ketamine is one of the poor muscle relaxant agent. So later you have to know some uses of ketamine. You see, at what condition ketamine may use. In asthmatics, treatment of asthma, ketamine may be used. In short surgical procedures, ketamine may be used. And in OPD surgical procedures, ketamine is used. These are the some uses of ketamine. Next, you have to know about fentanyl. Fentanyl is, is one of the opioid agent. So it is one of the neuroleptic analgesia, droperidol, and this is one of the opioid analgesic, and is used in diagnostic, endoscopic, and angiographic procedure. And some advantage and disadvantage is there, like some advantage like smooth onset and rapid recovery, and fentanyl also suppress vomiting of and coughing, and less fall in BP. So in this case, disadvantage also there. Fentanyl may cause respiratory depression, may increase tone of chest muscle, may cause nausea and vomiting. This all. So you have to know this. Again, complication of anesthesia. This is important slide. You have to know what are the complications of anesthesia during anesthesia and after anesthesia. When given as anesthetics to the patient, at that time this condition may cause means there may be chances of respiratory depression, again salivation, secretion, and fall in BP, hypotension, aspiration, laryngospasm, awareness, delirium, convulsions, and fire or explosion. These conditions may be there during anesthesia and after anesthesia, and there may be chances for nausea and vomiting, and there may be chances of persistent sedation, long time sleep, pneumonia, nerve pulses, emergence delirium, and cognitive defects. These are the some complications of anesthesia. You have to remember this. This is important slide. And again, you have to know this is the pre-anesthetic medication. In this chapter also, pre-anesthetic medication also mentioned. Why this pre-anesthetic medication is used? By name, you can identify. Pre-anesthetics means before anesthesia. Before administering anesthetics, pre-anesthetics is given. But why? Because of some cause to relieve anxiety or to cause sleep or to reduce analgesia means pain, or for decreased secretion, for giving antiemetic active effects, and also decrease acidity. So by seeing of this aim or goal of the pre-anesthetic, so you can say what are the medication should be used. So for relief of anxiety, anti-anxiety drugs will be used like diazepam or analgesia for reduce analgesia means reduce pain. Opioid is used for decreased secretions. You can say anticholinergic drug used for decreased secretion, antiemetic effects. And emetic drug is used, decrease acidity. Here antacid will be used or H2 blockers will be used. By seeing this, you can say what type of drug should be used in case of pre-anesthetic. So I have included drug list also. You can see here, anxiolytics is used for reduce anxiety. Amnesia is used for sleeping. Anticholinergic, example is atropine, is used for reducing secretion. Antacid, H2 blockers, ranitidine, famotidine. Antiemetics is used to reduce nausea, vomiting. Analgesia, opioids, is used to reduce pain. These are the some pre-anesthetic medication. So thank you so much. Here you got. Here you have to remember definition of general anesthetics. Then classification of general anesthetics. Again, advantage and disadvantage of general anesthetics. anesthetics, pre-anesthetics. Next, drugs, drugs of pre-anesthetics. So if you know this, in case of a general anesthetic and pre-anesthetics, it is more than enough. If you got 10 marks question from these, you have to write all definition, classification, advantage, disadvantage of each drug class. Again, pre-anesthetics, why it is used, and what are the pre-anesthetic drugs. So that's all about general anesthetics and pre-anesthetics. Thank you so much. So this is one of the important topic, and if you need a notes, you can contact with me or you can give any comments so that I can share with you. Again, thank you so much.